Given the severity of the COVID-19 pandemic, the BCMA Board of Directors recommends that all Broward County residents over the age of 12 be vaccinated unless they have a bona fide medical exception. We're all now at the 20-year anniversary of the unfortunate 9/11 incident that affected basically everybody in the United States and globally with respect towards the restrictions and processes that one has to deal with if you have to go travel. And everybody complied with that. You don't see people protesting, making political statements with respect towards not wanting to go through metal detectors, avoiding carrying things on airplanes that could be potentially used to harm other people. So that said, this is another example of a reason why everybody should be compliant with being vaccinated, getting their boosters, wearing masks, social distancing. A lot more people died during this epidemic than were killed on 9/11. So that's a real sober thought. More people are dying as a result of the pandemic, and they're fighting the misinformation that is given from sources that are not credible and not relying on the science. And it's very easy to make this problem go away. Is just follow the science, listen to your trusted physicians, and get vaccinated and wear a mask. Doctors will wear a mask for 10 hours, 12 hours straight. I personally had a patient that came to me asking me to write a letter saying that she had a medical reason to not wear a mask. As she was sitting there, and she was not having any respiratory distress, she did not have a fever, I put a pulse oximeter on her finger. She had no idea what I was doing. And I asked her to read what was in front of it and gave her pulse. It was 70. And I said, but there's a number over this. It says 100. He says, yeah. I said, that's 100% oxygen in your body on room air wearing a mask. Masks do not decrease your oxygen. You're not going to suffocate breathing your own CO2. These are all nonsense arguments that people are tossing out that are just meant to confuse people and keep people from doing the right thing. As an aside, nobody complains about wearing a seatbelt in a car, and that's actually law. So there's many laws that are there to protect people as a whole, like wearing a helmet if you ride a motorcycle. In those states that actually have helmet laws, it's meant to protect the person. So having a vaccine is meant to protect you as well as the community as a whole. And it is a social imperative that everybody follow these rules, because as a society, we want to have a healthy society. Not being vaccinated and having sick people and dying is not good for the morale of the people, and it's not good for the country and actually for the planet itself. Thank you.
I'm here representing our healthcare community. We need your help, not only to vaccinate, but to continue to take safety precautions. In particular, we need you to continue to wear your masks. Wear your masks indoors. Wear your masks in crowded public settings. Wear your masks in school, at work, anytime that you might be potentially exposed to an unvaccinated person. Please continue to wash your hands. Help us to take care of you. Let's end this pandemic together. Thank you.
What we're here to say, all of us gathered here, is that enough is enough. We have to take a serious stand as doctors, as physicians, providing care to the community, that the community also has to show their part of responsibility. And that includes, as it has been said, to wear your mask in crowded spaces, indoors, social distancing, washing your hands. But in addition to that, it is my personal view that everyone should strongly consider to be vaccinated, because so many others who have been responsible and been vaccinated are getting sick. And I do not believe, and us as doctors, we do not believe it's fair. In addition, it has overburdened the healthcare system of Broward County, of the country, and the physicians have worked tirelessly to save lives. So I think it is the responsibility of the community to pay their part of their duty is be vaccinated and follow all social distancing and masking. And that's so much important in the Haitian community where there are a lot of misinformation, and it's not fair that these people are subjected to misinformation and this is leading to death. So we're here to say no to misinformation, and they should follow the correct information where the realistic sources, which are us here, the physicians. Thank you. Tant que nous capables ouais, nous avons un paquet de docteurs qui réunis là. Et une raison qui fait réunir ici après-midi à la Broward County Association, c'est parce que yo bouquet avec moun qui refusé pour un vaccin. Yo bouquet avec moun qui peut mourir pour grand messie. Qu'on y a là, moi c'est président Association des médecins haïtiens à l'étranger. Groupe docteur Sayo invité parce que c'est haïtien mieux que me parler créole pour me parler avec nous. Pour me dire nous que tout docteur Sayo bouquet travail matin midi soir parce que nous refusons pour vaccin. Et une bagaille pour nous comprendre dans pile mauvaise information qui pas correct qui rentrer dans la communauté haïtienne, ça l'heure pour le suspendre. Vaccin pas fort tourner diable, vaccin pas tuer, c'est pas service secret que vous mettez sur vous, son paquet de bonnes vieilles paroles. Vaccin pas tuer moun, au contraire, vaccin sauver la vie moun. Nous connaissons ça qu'on y a là. Si l'on de gain doute, qu'on y a là nous pas gain doute encore parce que pas jamais censé gon moun qui documenté que t'es pour vaccin qui mourit avec COVID-19. Ou que doit malade, ou que doit pas porter bien, mais ou pas mourir. Ou pas mourir avec vaccin. Donc c'est pour nous vacciner c'est pour nous mettre masque. Même j'aurais tout docteur mettre masque pour capable aider nous. OK? Là nous en de caille, mettez masque. Lavez main nous, kebe distance nous pour nous capable finir avec pandémie ça. L'hôpital yo chargé moun, yo pas ka traiter moun. Si moun pas ka l'école normalement, nous pas ka fonctionner normalement. Mes amis, c'est nous youn qui pour l'autre le bras pour nous finir avec pandémie globale ça, COVID-19 ça. Donc, mais même personnellement, m'a recommandé nous fortement aller vacciner et pas perdre du temps. C'était mon qui remène Dr. Angelo Gus. À la prochaine.
I wanted to share a quick message with you this evening. It's with immense sense of duty to our community and citizens of this amazing county that I, as the president of BCMA, give this message to you. As we reflect on September 11th, 9/11 that just passed, I had the privilege and honor to be standing on the same site along with our first responders and our heroes who truly define the word together and their heroic effort. Once again, we have an opportunity to work together to help our community, to impact our circumstances today. With that said, we advise that all individuals who are qualified to receive a COVID-19 approved vaccination to do so and encourage appropriate masking and using social distancing when indicated. Together and united with sense for community and responsibility for each other, I'm confident that we'll get through this and we'll have a better day. Thank you, everybody.
It's an honor and privilege to speak to all of you and to be joined by my colleagues in this pandemic. Broward County has suffered greatly losses of lives because we are not vaccinated. As you all know, that 99% of patients that are coming into our hospitals at this time are the unvaccinated. So I encourage each and every one of you, talk to your physicians, make sure you get the right facts, ask the questions. We're here to help you to understand the vaccine if you have concerns so that we can help you make sure that you make an appropriate decision, and I hope that decision for each of you is to choose vaccination. I concur with all the colleagues who have gone before. This is an opportunity for us to take care of our health, take care of our community, and to rise together to get better control of this pandemic. Thank you.
To me, I think this is vitally important. I'm going to take a different tact, a tact that I'm not terribly used to, but I'm going to take it anyway. I'm here to beg. I'm here to beg the people out there who are not vaccinated and don't mask to please do so. I'm representing tonight the doctors and the nurses that face every day going into the intensive care units. and see the patients in there struggling to breathe. I don't know whether people that don't have this experience are able to really appreciate the severity of the pandemic that we are facing. When this started 18 months ago, people were older. We kind of expected this to take place, but what's happening right now is we are seeing a much younger demographic. It is like going into a circle of hell, to walk in every day and to find nurses crying because they have bonded with the patient. They have seen the patient's family come in to say their goodbyes, and then the next day they come in and they find the patient has died. We've lost 2 last week, a young mother who was pregnant, who was flown in, and they took her baby with a hysterectomy. The baby survived, but she died the next day, never ever to hold that young baby. And all of this could have been avoided had people been vaccinated. So please, we ask you, we cannot take too much more mental trauma because the doctors and the nurses also have emotions and they bond with their patients. And what we are seeing right now is that younger and younger people are being afflicted. So please, you have the opportunity to do something about it. The Idaho Hospital Association had a great article a couple of days ago. What they talked about was that the effect on the stresses on the hospital. I don't know a hospital administrator, a doctor, or nurse who is not working their butt off to try to save people's lives, but it is putting a tremendous amount of stress on the entire system. People that have other conditions are not getting treated in a timely fashion that we would like. This needs to be and can be avoided. Vaccinations do work. If you are vaccinated with 2 shots, your chance of getting hospitalized and going onto a respirator is less than, I'm sorry to put it another way, 99.9999% chance of never getting that sick. So, with all sense of humility, I beg you, please get vaccinated. Please wear a mask. Please send your children to school with a mask. So let's get out of this the pandemic that we've been in. We can do it. We are a strong nation. We are a strong group of people. We know how to sacrifice. We can get through this. So this time next year, we will be living a normal life. Thank you.
I've practiced immunology in Broward County for over 40 years. We are not going to be able to end this pandemic without greater vaccination. That is the key. And I am sure all of those who are listening to me can agree on one thing. We're ready for this pandemic to end. And there's only going to happen one way, and that is you need to get vaccinated. It also protects those people that you care the most about, your children, your grandchildren, your spouse. We don't want to carry COVID to them. Maybe you survive, maybe you do fine, but they may not. So in the meantime, until everyone is vaccinated, wear the mask, social distance, and please encourage everyone in your circle to do the right thing and go for vaccination. Thank you.
I think it's very important for us to mention that, along with everybody else, that we need to both vaccinate and use masks. The problem that we are experiencing now is a pandemic that we never did before. And while all the questions about whether we should, when should we vaccinate, when should we wear masks, who should wear masks, facts are important. Masks and harm reduction techniques reduces the transmission of COVID, as well as vaccination. If you get vaccinated, it doesn't necessarily mean that you're never going to get COVID. It means that you're not going to die. And I think that it's important to realize, as an obstetrician and gynecologist, I also work with the American College of OBGYN in the United States. And when COVID affects everybody, it does not discriminate. It affects an entire family unit. It affects people that work at school. It affects the children that go to school. And therefore, it affects the ability for the children to be cared for. So what is important to realize, what we are not doing is making sure that we vaccinate all eligible people. We always talk about healthcare professionals, but it's not only healthcare professionals. It's school teachers, but it's not just school teachers. It is their support staff, the support staff in a hospital, the support staff in a business that's running, that's seeing patients that have COVID. It's important for us to realize that everybody should be vaccinated. All eligible individuals should be vaccinated. The support staff, if they get COVID, they affect the patients and they affect all of us together. Now let's talk about masks. I do not understand at all why mask is such a big deal in Broward County. It seems that Broward County became the center of controversy in the United States. People from all over the United States say this one county, in Broward County, why is everybody arguing about wearing masks? Nobody understands it. In fact, the children don't understand that. So what I believe we should do, the American College of OBGYN recommends all pregnant patients to be vaccinated, all families to be vaccinated, all eligible individuals, and the wearing of masks. And I think facts are important. Please look at the facts, help us get rid of the pandemic so we can go back to normal times. All of us are very tired. We're saying the same thing. It's up to us to make this go away. One of the urgency of this and why this needs to come out right away, not just Broward County, but Florida is the national look right now. Everybody is looking at Florida and Broward County because we have the most number of cases. We have the most number of people that die. We have the most number of people that get affected, and we have the most controversy. So we at the Broward County Medical Association, we came here today because we want to dispel all the controversy and make those recommendations, both for vaccination as for mask. Thank you so much.
I've been around practicing medicine and surgery for a very long time down in South Florida and in Broward County specifically. I think it's important that everybody understands that the world has dealt with pandemics in the past. We have eradicated smallpox. We've eradicated polio. Vaccines work. This is not an experiment. These medications that are available now have been available and have been used and studied for over 10 years. The messenger RNA vaccines. This isn't anything that's new or unique. They're safe. Everybody that you see here in front of this press conference has been vaccinated. Our families have been vaccinated. Our wives, our children, our mothers and fathers. We wouldn't be doing that if we as physicians didn't believe in vaccination as a methodology to protect the general public and to protect ourselves. I'm only going to say this. It's critically important that you listen to your physicians. If you have a question, call your doctor. You don't call other people, you don't call politicians for questions related to rashes, pain, and other issues that afflict you on a daily basis. You call your doctors. Call your doctor to understand what to do and trust your physicians. Thanks, and thanks, Abby, for letting me speak.
I want to bring to the stage the fact that children are no longer the safe people in our community. At the beginning of this pandemic, nobody was talking about children. It was the elderly. Now it's not just the elderly. So our children are as prone to getting this virus at this point as any of us standing on this asphalt. So I would recommend that we do a little bit of something that I don't think has been mentioned. I don't see a reason. I never had in my many years at Pediatric Associates a child come to me and say, I don't want to do something. They've always been nudged by the mother, you don't want to do that. So I'm saying, give the kid the mask and send him to school. He won't have any problems with that. The other thing is, let's go over hand washing. With children, their hands are in their mouth all the time. So let's go over hand washing, and probably even, I did with my grandchildren, we would the 20-second surgical hand wash. And they loved it. They thought it was a game. And the other thing is, right now, under 12, there is no vaccine for them, but there will be one. So keep it in mind that kids now are a target for this virus. And if the virus continues, the children will be the next people that will be filling up our hospital. Thank you, Abby.
I want you to know that the physicians in Dade County also support vaccination. We feel it is a responsibility, a medical responsibility, that everybody get vaccinated as soon as possible. That's the only way this pandemic is going to come to some sort of a conclusion. So take your responsibility, do the right thing for yourselves, for your family, for your community. This is a matter of citizenship. It's not a matter of rights, it's a matter of responsibilities. So do the right thing, get vaccinated as soon as possible. Thank you.
We're living in tough times. These are the times that we have a virus that affects everybody. It does not respect whether you're man, female, children, old. It doesn't affect, it doesn't care who you are. The idea is if you're vaccinated, you're protected. If you're not vaccinated, well, you take your chances. I'm going to say a few words in Spanish for those who live here in Broward County who have a lot of Hispanic people as well. So, aquellos que hablan español, mi nombre es Antonio Wong, doctor Antonio Wong. Yo practico medicina general en la ciudad de Pembroke Pines y estoy en las ciudades de South Broward, de la parte sur de Broward. Y tenemos una epidemia, una pandemia que se llama el COVID, que no discrimina a nadie. So, es muy importante que en este momento todos que están oyendo ahora usen máscaras, traten de evitar lugares en que puedan contagiar a muchas gentes, lávense las manos lo más pronto que puedan y mantener la distancia. Pero lo más importante de todos es vacúnense. El 3% mundialmente están vacunados. Significa un 97% del mundo no tienen el lujo y el privilegio de que nosotros tenemos aquí la vacuna disponible y sin costos adicionales. Mucha gente quisiera estar aquí para tener esta vacuna. Tenemos la oportunidad de dárselo a todos los ciudadanos y a todas las personas que lo pidan, sin mucho contraindicaciones. Así que por favor, todos aquellos que estén oyendo, únanse en esta causa de prevenir para que todo el mundo estemos más saludables. Mientras más saludables estamos, más vamos a compartir felicidad en toda la comunidad. Eso es muy importante, vacúnense ahora mismo. Y lo más importante que ahora, octubre, noviembre y diciembre, viene la temporada del flu. El flu es una gripa que todo el mundo puede confundirla. Y también hay que tener mucho cuidado que no confundan eso con el COVID. So, por favor, vacúnense a todos. Nosotros todos estamos aquí vacunados y somos médicos. Así que estamos bien conformados con la eficacia y el beneficio de esta vacuna. Muchas gracias.
It is extremely important that we get vaccinated. My feelings are even stronger. Through FEMA, I was set down in Pueblo, Colorado at a hotspot where I walked into a school and there were no kids. And I said, what's going on here? And 300 kids had gotten sick with COVID and the school was shut down. And we were responsible for vaccinating, doing outreach to underserved communities. And I was there in the capacity of doing best practices for post-vaccination monitoring. And it was so sad that before we started our morning, we had to have training in terrorism because it was expected that parents were going to come and terrorize us for doing the right thing, for vaccinating kids in a school where 300 were sick. And I can just tell you that we required the kids to bring a letter signed by their parent saying that they could have vaccination. And the majority of the kids came with no parents, but they had those letters in hand. And this community needs to stand by our children and do the right thing. They need to wear masks and they need to get vaccinated, so please help, I'm begging you.
I'm very honored to be with this group of doctors tonight, and I feel very passionate about this topic. You can ask anybody who knows me. It's hard to get me to talk about anything else. And something that has struck me is the amount of videos I've watched that people post on social media, people on their deathbeds, crying and gasping for air and saying, I wish I had gotten vaccinated. Please, don't wait like I did. One woman said, well, I wasn't vaccine hesitant, but I wanted to do my research. And so I assume her, like many people, are hoping Google or their Facebook groups is going to provide them with some research that the doctors and the scientists aren't. But we can all stand here tonight and tell you that these vaccines do work, and that everybody who is eligible to be getting one should be getting one. This is not an affront to your personal freedoms. Wearing a mask is not an affront to your personal freedoms. Okay, it's about loving your neighbor and your fellow Americans and doing the right thing to protect other people. That is one of the foundations that this country was made upon, was looking out for the rights of others, not just for the rights of yourself. Because this doesn't just end with you. This isn't just about your personal freedom, it's about other people's freedom to be free from disease and illness.